Something doesn't quite add up. The US spends trillions in its healthcare system, yet hundreds of thousands die each year due to lack of access. That's nearly 16 times the number of people who died over a decade in the UK, even with their universal healthcare system.
Really?
Guess what? Around 48% of healthcare investment in the US is coming from the private sector. The business is booming.
Interesting. Let's dig deeper into that, okay?
Hello and welcome to AnewZ Fact Check. I'm Ali Sultan.
And I am Sabina.
Let's get to the facts behind the figures
and uncover the rhetoric driving those facts.
In 2023, the United States spent approximately $4.9 trillion on healthcare, about 17.6% of its GDP. Public programs like Medicare and Medicaid accounted for 48% of the spending, while 52% came from private insurance and out-of-pocket costs.
Despite this level of spending, access and affordability remain key challenges for millions of Americans.
This raises an important question: health or wealth? How do economic and financial interests shape the healthcare landscape? Almost every presidential candidate, particularly those advocating healthcare reform, has proposed solutions. But have these policies significantly changed the system?
Healthcare access and affordability in the US have been debated for decades. While various policies have attempted to address systemic issues, the influence of major insurance companies remains significant. So what are the barriers to reform? Are health insurance companies too influential in shaping policy?
Yes, they contribute significantly to political campaigns, influencing policy discussions on healthcare reform. For instance, United Health Group has spent over $13 million on lobbying and political contributions in recent election cycle. Such funding plays a role in shaping policy debates. The healthcare system in the US operates within a complex framework where financial interests and patient care priorities often intersect. While the sector generates substantial revenue, questions persist about how effectively resources are allocated to improve patient care.
Consider Jeffrey Kivi's story. He's a high school teacher who relied on Remicade infusions that initially cost $19,000 a month. When his doctor switched hospitals, the price increased to $132,000 a month due to marketing, patents, and hospital fees. Kivi ultimately sought alternative treatment. His story, as detailed in Elizabeth Rosenthal's An American Sickness, illustrates how the healthcare industry has evolved from non-profit care to a major economic sector. Despite nearly 20% of US GDP being allocated to healthcare, affordability remains a challenge for many.
Kivi's case is not an isolated one. For example, Anthem Blue Cross once proposed a policy limiting anesthesia coverage based on surgery duration, a limit determined by cost-cutting measures that raised concerns among patients and healthcare advocates.
Following public backlash, Anthem revoked the policy. However, broader discussions on cost management in the healthcare industry continue. Critics argue that rising costs contribute to increased insurance premiums, making coverage less accessible.
A recent report, Mirror 2024 by the Commonwealth Fund, ranks the US lower than many other developed nations on key health indicators. Life expectancy in the US remains below the average of peer countries, and rates of preventable and treatable deaths are among the highest. Despite being the highest healthcare spender globally, the US faces challenges in health outcomes, with disparities in access and life expectancy.
Meanwhile, countries like the Netherlands, Australia, and the UK report better health outcomes at comparatively lower costs. In the US, health insurance companies contribute over $100 billion in taxes annually. This raises discussions on whether such contributions should be redirected towards improving accessibility and affordability.
A portion of corporate taxes from healthcare companies contributes to general federal revenues, which fund various sectors, including healthcare, defense, and other national programs.
The US allocates over $800 billion annually to its military, with additional funding supporting international security initiatives. Those budget allocations continue to spark policy debates on national priorities.
This interconnected system highlights broader questions about balancing public expenditures. Healthcare remains a personal concern for millions, yet its financial structure has wider economic implications.
From the cost of medical treatment to broader fiscal policies, the US healthcare system reflects the complexities of balancing public needs and economic considerations.
The structure of healthcare industry continues to evolve. While reform efforts remain a priority for many policymakers, debates on financial sustainability and accessibility persist.
Newly elected President Donald Trump's healthcare proposals focus on reducing drug prices and increasing transparency, with debates on their potential impact continuing.
The relationship between US domestic policies and foreign engagements remains a topic of discussion, with Trump's administration advocating for a less interventionist approach.
That's it for today's Fact Check, where we go beyond the headlines to bring you the facts shaping the news.
Follow us on social media for more stories and deeper insights. Until next time, stay informed and stay curious.